Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we're speaking with Barby. We spoke with Barby recently about a different medical diagnosis. Today, we're discussing complex regional pain syndrome, formerly known as reflex sympathetic dystrophy syndrome. Boy, those are mouthfuls.
I was going to say it. Say it all 5 times really fast.
Welcome back to the show, Barby.
Thank you so much for having me again. I really appreciate it, and I think that this is definitely the condition that most affected my life in a negative way, and I've tried to turn it into a positive, so I'm glad to be here to share this part of my journey.
Thank you.
Good. It's good to talk with you again, Barbie. Thanks for coming back.
Hi, Barbie. I wonder if you could start us off by telling us a little bit about what exactly is complex regional pain syndrome?
Absolutely. Complex regional pain syndrome has actually gone by over 20 different names since the Civil War. Doctors keep discovering different parts of the condition, so they keep changing the name. Mm-hmm. And I say reflex sympathetic dystrophy instead of complex regional pain syndrome because I was actually diagnosed first with causalgia and then RSD, reflex sympathetic dystrophy, and now I have full body, so that now with full body they call it central pain syndrome instead of the complex regional pain syndrome. But it's all really the same disease. So whatever you call it, that's what I'm talking about.
Okay, all right.
Well, even in the ICD codes that the insurance companies and the doctors use, CRPS-I is considered RSD and CRPS-II is considered causalgia. Okay. And I've had both of those diagnoses. But basically it's a neuroautoimmune disease, and there's 2 types, type 1 and type 2. So type 1 is when you have a known cause, like a nerve injury or something that triggers it. And type 2 is when they don't know what triggered it, but both of them are treated the same way. So I don't even know why they split it out, but they find a reason or need to split it out into a known cause or unknown cause.
Do you happen to know what caused this condition to develop with you?
Well, what they found in 2012, there was studies that came out in Canada and Liverpool that showed that it's actually a blood disorder. It's a virus or a subvirus in our blood, and it's triggered by a trauma. For me, it was an 8-second car accident, and I don't know why this is the incident that changed it to trigger for me, because I've been an athlete my whole life, and I also went through endometriosis and went through surgeries with that, and none of those things triggered it. But all of a sudden, this 8-second car accident, which was a pretty minor car accident compared to other accidents, it triggered it for me. I've heard of other people stepping on a rock and it triggering. Wow. So, it could be something so minor, a needle poke or something that will trigger it to attack, but we had it in our blood prior to that moment. Oh, that's just the inciting incident.
Okay. And can you tell our listeners how this syndrome usually affects people, how it affects you personally? Like, it's painful, but what exactly hurts?
Yeah, pain is the worst symptom, and that's the original word for CRPS was causalgia, which is burning fire pain. That's what it means. Oh. So that is the worst symptom. But there's not just the burning fire pain. That's kind of all the time pain. And then you get these other intermittent pains, aching, burning, crushing, dull, electric. So that's the worst of it. You also get bone changes, or some patients get, depending on how bad it's affecting you or targeting your body. You can get softening of the bones, osteoarthritis, which I have from this as a secondary, osteoporosis, osteopenia. You can get cognitive memory issues with your short-term memory. It's really hard to concentrate and think when you're in that severe of pain. The worst pain is the fire pain. It feels like someone put lighter fluid on me, caught me on fire, and it's just extremely difficult, if impossible, to put out.
Wow.
I can't even imagine what that would feel like. That's terrible.
Right. That's what you if you can control that fire pain, the rest is not so bad. It is bad, but it's not as bad. But you also deal with chronic fatigue, emotional disturbances. It definitely caused for me depression. I lost everything I worked my whole life for, and I was living my dream when I developed RSD, CRPS, and it literally, I lost everything. I went from being on top of the world to food stamps and not knowing how or where I was going to live the next month. And it does affect your life in many ways. So you will get anxiety and irritability and agitation and depression.
Yes.
It also,
I mean, people aren't made to really deal with that type of a pain all the time. You know, it would definitely affect your psyche.
It absolutely does, and it's not fully understood. So it really, I mean, I just went through some of the symptoms. I also lost partial vision. It affected my hearing. It affected sensitivity, like the ceiling fans. I'm like, can you turn off the ceiling fan? It feels like somebody is taking knives to me and cutting me just from the wind of the ceiling fan.
Wow.
I started developing low-grade fevers. I got limbic system dysfunction, movement disorder called dystonia, where my right arm curled up, and because of doing the wrong treatments and being wrongly diagnosed for 3 years, my right foot curled up and my right arm and hand curled up. So with dystonia. So I had those changes. I had changes in my hair and nails and swelling changes, sweating changes, spasms, skin rashes. All the sleep disturbances were awful. So it affects every aspect that you can imagine in your body, but also in your life. It affects your relationships with your family, your friends, your sleeping, your finances. Everything is affected with this condition.
Wow. And Barbie, how long has it been since the accident that started or incited this condition with you?
Right. September 26, 2002, the day that changed my life. And so it's been almost 18 years. In September, it'll be, I guess, 18 years.
Yeah, that's a long time. That's a long time.
Yeah.
Absolutely. And it took, like I said, it took 3 years to get a proper diagnosis, and it took 43 doctors.
Wow.
And yeah, and I was going doctor to doctor to doctor because I knew I would not have given up the life that I had made for myself.
Right.
But all of a sudden, things like I could push through with endometriosis, I couldn't push through those anymore.
Right.
This was
way over and above.
Way over and beyond, yeah.
Mm-hmm.
It's known as a spinal disease, so.
And Barbie, you say that the pain is constant, and then you have sporadic worsening pain. Is that what you were saying?
Yes, that is what I'm saying. The burning fire pain is all the time, and then you have these other pains that can hit at any moment. Like I would just, and sometimes even still now, I'm in and out of remission since 2009. But those electric pains, it's like lightning comes out of the sky and just zaps your body, and you don't know where it's going to hit. But I've never been hit by lightning, but this is what I imagine lightning to feel like. And it can hit anywhere in my body because I have full body RSD. So even before I was diagnosed with full body involvement, including my internal organs, I was having these electrical pains and the bone pain and the searing pain, which those, are intermittent versus that fire pain that's all the time.
And the fire pain, is that like at the skin level, like a severe sunburn, or is that internal? Like, do you feel like the burning is inside of you or just at the skin level? I'm just trying to visualize this.
Right. Visualize this. Imagine someone putting lighter fluid in your veins and it's coursing through your body.
Okay,
my goodness.
Inside.
Right, but my skin is very sensitive, so the flame comes from the inside, but it goes all the way through.
Of course.
And some people with regional pain, I know a woman who's had it in just her pinky for over 20 years.
Wow.
It only affects her pinky.
Wow.
But she didn't go through, I went through years of surgeries and traumas and additional things that I was doing incorrectly, not knowing what disease I had. I was improperly diagnosed.
Wow.
She never had any other injuries besides her initial injury to her pinky area, and it stayed there. It only is affecting that one area of her body.
Wow. Barbie, can you tell our listeners how this syndrome usually progresses? Is it something that builds up with time, like, say, arthritis?
It came on instantly, but I didn't know what it was or how to describe it for me, but it wasn't my full body. Mine started in my face, neck, and shoulder. And then due to additional traumas and surgeries that I went through, it started spreading. And so I knew, like, when it spread to my foot, my husband came home from work that day and I was like, I got a splinter and my foot's on fire and you got to get the splinter out. And he's like, taking a magnifying glass, searching. And I'm like, no, search again, look again, get a bigger magnifying glass. Mm-hmm. Like, you have to find something. Like, I didn't, at that time, I didn't know that it could spread or what I even had.
Sure.
I'm just telling him, like, find whatever it is and fix it.
Right.
But other people, like I said, the one woman, she had no other inciting incidences after that initial incident, and she still has it just in her pinky. Whereas for me, it spread every time I did something I wasn't supposed to, a new surgery or even the wrong type of physical therapy can cause it to spread.
Okay.
Oh, wow.
Needle pokes can cause it to spread. So with me, it had internal organ involvement. I was fine one day, and the next day I was eating dinner at a friend's house, and my gallbladder died.
Oh my goodness!
It wasn't getting the proper blood flow. So I went through that. I've gone through gastroparesis, intestinal ischemia, cardiac ischemia. 2 of my heart valves went bad. All of this is secondary to RSD, CRPS, and because of that, I have gone through a lot more than the average patient with regional pain syndrome.
Okay. Well, certainly sounds that way.
Yeah, you've gone through more than most people do in their lifetimes.
Yeah, I think more than
absolutely.
the city that I live in goes through in a lifetime.
Yeah.
Barbie, do you know what population is usually affected by this syndrome, like age, sex?
They say that the age range typically hits 40 to 60-year-olds.
Okay.
But I know there's patients as young as 2 years old that have been diagnosed and as old as 101.
Oh.
Okay.
And for me, I was 29 when it hit. And there's, in the United States, they call it a rare disorder. Mm-hmm. The NORD, the National Organization for Rare Diseases, calls it a rare disorder. And they say that there's less than 50,000 cases a year that are diagnosed. If you do the math, even at 50,000 cases a year, we're still looking at 1.5 million people in the United States that actually have the disease. Mm-hmm. But they also say there's under 200,000 cases in the United States. But that's if you call it CRPS. If you use all of the names that this same disease goes by, we're in the millions.
Okay.
So it's a lot larger than most people would even think.
It's a lot larger than most people think, and so, but it just depends on what the doctor learned in medical school and how they diagnose it, and if they're an older doctor, they might be calling it causalgia still.
Sure.
Okay. If they're a newer doctor, they're going to be calling it CRPS or central pain syndrome if it's the body. So it really depends on the doctor's knowledge and what that doctor is calling it.
Okay. Thank you.
Barbie,
you're welcome.
What treatments have you received for this condition, and have any of them been helpful?
Yes, like I said, I'm currently in and out of remission since 2009, but I've gone through a lot of treatments, so I'm going to try to remember off the top of my head some of the things that I've done. For nerve blocks, I've done 38 nerve blocks on my neck. I did 3 epidurals, 36 radiofrequency ablations. I've done some cortical integrative therapy techniques, mindfulness, biofeedback type stuff, mirror therapy. I've done infusion therapy with stem cells and ketamine. I've also looked into IVIG, but I haven't done that yet. And multiple medications, not just pain medications like opiates, but also seizure medications, muscle relaxers. I also developed vertigo where like my world would flip upside down randomly. And I was on a medication for that. I also developed migraines from this or during this time. And so I'm on a migraine medication. I also went through counseling. Obviously, my whole life fell apart. I needed counseling.
Oh, yeah.
Understandable.
Yes, I would imagine that it affected you emotionally, beyond what a typical person could handle by just meditating. So,
Absolutely.
how
So I went to counseling and learned some tools in counseling. One of my favorite tools, which I just did a talk on this a couple of weeks ago in Dallas, Texas, is the I Am game, and my therapist taught this game to me. I'm going to explain it really quick for your listeners.
Sure.
Yeah.
But so basically, I went in and I was like, I lost my cheerleading career. I physically couldn't be the athlete that I had been my whole life. And I was curled up in a ball on my therapist's couch, just hysterically crying. And he said, I'm going to send you home with this exercise I want you to do. And he said, it's called I Am. I want you to answer this question. I am. What's the answer?
Mm-hmm.
And I was like, I am nothing. I suck. Everything that I had put my whole life into cheerleading and dance and performing, and everything that I was gone. Or at that time, I felt like it was gone. I was still losing things. I just didn't know how far down I was going to go from there. I thought that was the bottom.
Mm-hmm.
And he called me 3 days later, and I'm still hysterically crying, not getting anything done in bed. And he said, just call and see how your list is, because you're coming back in 4 days, and I want to make sure that you are working on your homework all right. And I said, I'm nothing. I don't have anything. And he said, okay, well, how about you go to church, you're spiritual. How about I am spiritual? Can you agree to that? And I said, yes. And he said, okay, let's start there. And he said, you're a cheerleader, so you're cheerful. And I was like, I'm not too cheerful right now. And he was like, but it's in you. It's part of you. So you can write down, I am cheerful.
Okay.
And he helped me get my list started. And by the time I got to his office, I had 75 I am.
Okay.
Oh, good for you.
It gave me a list to show me that I was more than all the things I was losing or lost.
Mm-hmm.
That's an excellent tool.
Yeah, and I still use it to this day. I have over 150 I ams on my list, and when I'm having a bad day or a bad moment, I pull out that list and I use that list. And it's something that all of your listeners could use as a tool in their life as well.
I love it.
Yeah, that's absolutely wonderful. Barbie, is there a cure for this condition? I know that's probably asking a lot, but I'm just wondering,
or maybe if they're working on something.
Right? Is there something on the horizon as far as a cure goes?
There is great reason for hope, but there is no cure.
Okay.
There's treatments that they're coming up with, and it's typically not one treatment that helps you go into a remissive state, and there's nothing that keeps you in a remissive state. So there's treatments that are helpful. There is no cure. They are working on, because they found that there's these two autoantigens in our blood,
right?
And they know what they are. They are working on a medication or treatment that can eradicate that autoantigen or the two autoantigens from our bodies. Mm-hmm. But at this point, that has not been done yet. But they are working on it and towards it.
Well, we'll pray for a cure.
Yeah.
Barbie, have you found any relief through self-care or recreational pursuits or maybe support groups?
I've done support groups, and the local in-person support group that I went to, mm-hmm. The first day I went, I was telling them the different things that I was doing and trying, and they just poo-pooed all of the options that my doctor was giving me. I was like, you're giving me no hope. And mm-hmm. and I stayed and tried. I continued to go for about a year to that support group. I didn't get the help that I needed. I as you said in the intro, I do run the International Pain Foundation. So I have kind of created a support team around me. And so I have my own support group, but it's not like an official support group. It's just patients that have the same conditions that we talk online or we talk on the phone, but we don't necessarily meet in person. We're spread out all over the world. But some of the other types of treatments that I use are posture apparel.
Okay.
A lot of times when you have a lot of pain, you start to curl up.
Mm-hmm.
So the posture apparel helps me keep straight, and it helps my spinal fluid flow more correctly, lowering neuroinflammation. I also use the oral orthotic, acupressure, heat therapy, aquatherapy. I went through occupational therapy and physical therapy, as I said earlier. I tried trigger point injections. For me, they didn't help. I've heard other patients say that they like them. I do sound therapy and aromatherapy. I haven't myself done CBD or medical marijuana, but I have thousands of friends who have, and they swear by it. I do the infusion therapy with ketamine as needed now. I use prayer. Over the years.
I don't want to interrupt you, but Barby, I heard that ketamine can burn as they're injecting it, and that's one thing you don't want because you already have that. Have you noticed that?
Not at all. I've been doing ketamine infusion therapy since 2009.
Okay.
I get it through a portacast. What would burn more is sometimes the saline would burn.
Okay.
I don't know if ketamine actually does.
Okay.
I've never experienced that with ketamine, but I have with just pure saline
Oh.
especially, I have vascular constriction, so I have a portacast placed in my chest.
Okay.
It's infusion therapy. But when I've had saline through my arms or foot or groin, it can get that with the saline, that burning. But with the ketamine, I don't get that at all. And it actually, ketamine turns down the microglia in our spine and brain that are firing. I don't know if you've looked up Dr. Linda Watkins at the University of Colorado, but she does a great like a cellular video. It's like 4 seconds long, but it's amazing. If you guys want to go look at it,
Sure.
Sometime. But that video shows like when they put an opiate into our system, the microglia fire. When you have RSD, those microglia fire about every 2 minutes, and that's the message that's going out saying something's wrong, and why you have that burning fire pain. Ketamine actually turns down the burning fire pain.
Okay.
And it deactivates the glia. So it's not a cure, it's a treatment, but that's what's happening when the ketamine goes through you. It also works on your NMDA receptors, I think I'm saying that right, in your brain, but most effectively is what it's doing to the glia, which lowers inflammation in your spine and brain, which lowers pain throughout your body.
Okay.
Thank you. Can you tell us the complex pain regional syndrome? Is that fatal? Can it be fatal?
It can be fatal, and it's not actually the disease that's fatal, like heart disease, but it's what comes secondary to the condition that can cause it to be fatal, and it's the gateway to other diseases. So dysautonomia, which is the blood pressure issues, the vascular constriction, like I was just talking about, autoimmune diseases, it brings on secondary conditions that can be fatal. For me, I didn't have proper vascular flow to my intestines, to my stomach, to my heart. I was facing open heart surgery, 2 valve replacements. They were going to put pig valves into my heart. Things like that are the things that can lead to death. I would take about 6 steps and I would be so out of breath and feel like I was drowning. And I spent about 7 years in a wheelchair. Those are the secondary things, are the things that would kill you, not necessarily the disease. Is the autoantibodies or the virus in our blood.
Right.
Well, Barby, going back to the technique your therapist taught you, saying, I understand that in addition to all of the things that you have accomplished, you are also an author. So you can add I am an author to that long list. Where can we find our copy or get a copy of From Wheels to Heels?
It's available in bookstores. It's available on Amazon, and it's also available on my website, barbyingle.com. And it really goes through my journey, starting with endometriosis all the way through to just a couple of years ago, what I've been going through, all of the other surgical procedures and tests and treatments and string of doctors. It goes through that whole journey with pictures and testing results, and also tips and tools for living a better life with chronic pain, and how I got through it to help other people find what's right for them. And what works for me doesn't work for everybody. I'm not a doctor, although I do teach doctors about the disease, and they get continuing education for that. I'm not a doctor, so each patient I encourage them to find what works for them, and it's not going to be the exact path or treatments that I've done or tried or still use to date. It's going to be finding your own team of support. It's going to be finding your own treatments that help you. And unfortunately, it sometimes feels like you're a guinea pig, but once you find things that help, it can give you life back.
Okay.
Well, that's good.
Yeah.
Barby, how can our listeners contact you through social media?
Or learn more about you?
I'm on Instagram, Twitter, Facebook, and LinkedIn, as well as I have my own website, barbyingle.com. And then I'm also the president of International Pain Foundation. You can get more information about this disease or other diseases that involve chronic pain at internationalpain.org.
Okay, great. I will put that link on our website for you. Well, thank you very much for joining our show today. It was good talking to you again.
Yeah, thank you, Barbie.
You guys too. Thank you so much for letting me share my story, and hopefully I'm helping other people find their story and their journey, and hopefully some help and relief.
Absolutely.
Best wishes to you.
We'll talk to you again soon.
Yep.
And if our listeners have any questions or comments related to today's show, they can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a 5-star review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.